So now it is my pleasure to introduce Dr. Mariana Casal Singetary, MD and MPH 2014, has an MBA in 2017, and she will one of our alumni that she will talk about how the scholarships have a lifetime impact. Scholarship not only support students while they are attending college, they also have a lifetime impact. Your generous giving allows students to graduate, bring their knowledge to the world, and build their careers in public health. With the skill they learn at MEZCOPH, our scholarship graduates go on to make a real difference in communities locally and globally. Today, I would like to introduce one of our alumni who benefited from a scholarship. As I said, she is Dr. Mariana Casal Singetary. I hope I pronounced the name correct. As an MPH student at MEZCOPH, Dr. Casal Singetary received the Nichols Initiative Scholars Award. This award is given to an MPH intern who's proposed as best outline an internship, research, or preceptorship experience designed to promote policy, advocacy, or innovative service delivery in our rural or border communities. Mariana's story is truly impressive. Prior to attending the University of Arizona to earn her MPH in 2014 and her MBA in 2017, she received her medical doctor degree from the University of Valparaiso School of Medicine in Chile. She subsequently completed the required residency at the Naval Hospital there. She then worked as an attending physician in emergency department in Chile and in Germany. After moving to the United States, Dr. Casal Singetary served as the Arizona Border Infectious Disease Surveillance Officer at the Arizona Department of Health Services, Office of Border Health in Tucson, and recently served as the Infectious Disease Epidemiology Surveillance Division Manager at Pinal County Public Health Service District. Please join me in welcoming our accomplished alumna, Dr. Mariana Casal Singetary. Please.
Hello, this is the fanciest lunch I have had in these grounds. I usually ate there under the sun, lizarding a little bit while trying to study. And I can say that it was a bad idea to use high heels, but I'm also vertically challenged, so it's better. So first of all, good afternoon. It's a pleasure to be here celebrating my birthday with my Pinal County by Public Health family. There is really not better place to be with your public health family. MEZCOPH College gave me the opportunity to complete my master in public health in 2014. As a student, I did my internship at the Office of Border Health, and because of that project, I received the Andrew Nichols Award for my project about coccidioidomycosis in 2 sentinel sites at the Arizona border region. I was asked to tell a little about how the award helped me with my public health journey. Amber, if you told me that you're gonna list me as a key speaker, I will not be here. But I can say that everybody knows there is no doubt that money is always welcome when you're a student. In Spanish, we said we are estudiambres, and that translates a little bit in a student and hungry. Difficult to translate. But for me, the important part really was the recognition of being following the steps of a border leader like Dr. Nichols. He was a visionary about rural health in Arizona, besides being a professor of medicine and an Arizona senator. I am not the best person to talk about him, so I will limit to say what I really believe. I believe that he knew the importance to incorporate educational experience at the border region for public health students and professionals. Since I was invited to this event, I have been thinking on what I learned during my time working at the border region. And because I tend to talk too much, really, I would like to limit my experience to 5 topics that I consider crucial to learn when you're in public health. The first thing that you learn is community participation is different at the border health. They do different things, but they do it together and across the border. And you prepare the same activity at both sides of the border, and or they are done together at both sides and you end together at the line, or you cross and you participate here and then you participate there. And here will be in English and there will be in Spanish, but everybody goes through, and it's really an experience. My best example of that will be the Binational Health Week. That was something that I always look forward at the office. I think the second thing that I would like to highlight is that you learn cultural sensitivity. You really learn to talk local. You know, it's not the border, it's the line. You go to the line, I pick you up from the line, I drop you at the line. Crossing daily, it's not a big deal. There are some kids that do that for school. They go to school, they live in Mexico, cross to the States, and cross back for lunch, and cross back for after-school student activities. So it's not that this is what you do all the time. Also, you're not going to Mexico. You're just going there. You're just crossing the line. And I always refer to a story working on a dengue outbreak between San Luis, Rio Colorado, and Yuma area. And the people from CDC came with the questionnaire ready saying, have you been in Mexico? And we were supposed to detect binational cases. So all the people from Yuma answered, no, I have not been in Mexico. No, long time ago, no. Okay, so we're in trouble because I was convinced that we have like 100 cases and nobody has been in Mexico. So I go, you know what? You need to change the question. Ask, have you crossed the line? Have you used your passport? Oh, yeah, last week I was in San Luis, Rio Colorado. Yeah, I went to visit my family. So that's when we detected our cases. But that's life. Mexico is going to Hermosillo, is going to Sonora. Going to Ciudad de Mexico is going to Mexico. Here is just there. Just like, yeah. So the third thing that I would like to highlight is access to health and what you learn about health equity. You know, sometimes one rural hospital serves both sides. The Mexicans that live here go to the Mexican hospital. The Americans that live here come here. And about health equity, the rural hospital always have limited services. Sometimes there is only an emergency room. There's no hospital. You're lucky if the helicopter is there or they need to call for it. So sometimes giving birth in these hospitals across the border will mean this will be a helicopter ride for a mother or a baby that are in distress. You learn that. You see it. Number 4, I'm almost there. Number 4, social determinants of health. That's a word or a phrase that we are listening most of the time lately. The border reality is different, and we learn about that. We learn about the lack of opportunities for youth, especially for youth people. That translates in high adolescent pregnancy rates and high transmission of STDs and drug use. It is sad that there are so many bad influence of certain role models that you ask the kids in elementary school, what do you want to do when you grow up? And they said, I want to be a sicario. And that hits you really, really hard. And for me, a sicario is actually assassin, a person that is involved with drugs, like the drug commander of the area. It hits you really hard. I think that's one of the most important reasons why we have the health education centers at the border founded by Dr. Nichols. CHEC, I don't know if Gail is here, but CHEC was our second home when we were at the border, working at the border. So those are places where every public health student, in my opinion, should work for a little bit. And number 5, a different kind of teamwork. You know, you learn to work, teamworking, the students, but there's always one student that's everything. Let's be clear. And then the others come and for the right and said, oh, yeah, we did it together. Yeah, I did the analysis. Okay, they run the program. They run the SAS program that the other one Yeah, no, you really learn a different kind of teamwork with international relationships. And we're talking about international because we have nations, sovereign nations at the border, tribal, and we have Mexico. We have Arizona and Sonora relationships. Learning to work like that is learning to commit from the beginning that we are going to work together. I'm not coming with the project, here it is, ready to sign. I'm coming to work with you, to see your needs, to learn, to discuss ideas from the beginning. And we will work together the whole project. At the end, you don't come with the project ready. You develop the project and have the inputs of everybody and work with them step by step. That's it. I hope it was not too long. And I will say that I can go, of course, but we need to eat. And I would like just to give the last summarize on the best lessons that I learned from my boss at the Office of Board Health. He always said, be aware of the 3 C's. Communicate, coordinate, and then you are able to collaborate. Thank you.